Our next session, Healthy People and Healthy Planet. What's next? Please welcome our moderator, Jennifer Duran, Global Head of Sustainability, Kenvue.
Great, good afternoon. Thank you everyone for joining us. Thank you Nest for this opportunity. And thank you to my amazing fellow panelists for making the time to talk with us today. We're gonna spend the next 30 minutes or so exploring the intersection of climate and human health. And we're planning to ask ourselves, how can the consumer health sector help people better adapt to a changing climate? What are their needs going to be in the future, and how do we meet those changing needs? So it's a big topic, but we have the right people here with us to help explore. So let's get started. First, I would like to introduce you to Kenvue, if you're not familiar with it. We are a large global consumer health company. We spun off from Johnson & Johnson in 2003, and we're the maker of many iconic brands that you know, love, and probably have in your household, like Listerine, Neutrogena, Johnson's Baby, Aveeno, Zyrtec, and many more. I'm Jen Duran, and I lead Kenvue's global sustainability strategy. And I'm going to ask my fellow panelists to introduce themselves the first time they speak. I'm sure they'll do a better job than I'd be able to on their amazing backgrounds. So, at Kenvue, our purpose is to realize the extraordinary power of everyday care. And that guides everything we do, from how we are intentionally embedding sustainability in product innovation, to how we partner on our public health awareness and education campaigns, our commitment to reducing emissions, and how we're really embedding sustainability-driven decision-making across our organization. Our sustainability strategy is called Healthy Lives Mission, and it's intentionally designed to serve our purpose. So, our first question I'm going to ask to Vinay. Please introduce yourself, and I'd like to, given your role leading our global baby brands, if you could just talk a little bit about the connection between human health and the environment that you are seeing in your work.
Of course. So hi everyone, my name is Vinayak. I lead the baby brands globally at Kenvue, so very known brands like Johnson's Baby or Aveeno Baby. And at Kenvue, we always put consumers first. So we listen to consumers a lot. And we've been seeing in the past few years that the awareness of the impact on the environment on consumers has been increasing. So impact on the sun on my health, mosquito pollution on health in general, but also on the skin. And we've seen that not only in developed markets, but also in developing markets where we listen to a lot of consumers in India or in Brazil, and we've heard a lot of awareness of the impact of sun, mosquito pollution on health and on the skin. And what we've been doing, if I can give you a couple of examples, one example from India is we've seen that there's been a lot of prevalence of sensitive skin among babies more and more. In the past few years, and this is mainly due to the increase of pollution, the increase of problem in the water, and actually this has become a massive challenge for moms and pediatricians. So we've been working with moms and pediatricians in India to increase actually the awareness of how you can treat and soothe sensitivity that is due to pollution and to external environment. So that's one of the examples. Or on sun, right? So, of course, sun is a big challenge for the consumers, and even if they know about it, they don't necessarily use a sun product every day, especially in developed markets. We see that a lot in the US or even in Europe. So again, we've been training pharmacists. So we've trained 7,000 pharmacists in the US and 12,000 beauty advisors in the US since 2020 to actually increase the awareness of consumers that actually it's really important to use a sun product to prevent for cancer. So these are a couple of examples that I can share that we are doing at Kenvue.
Yes, thank you. As a mom of two myself, I know the importance of all of those protection elements you just named. So if we think about going from protecting our families to protecting communities, Sarah you're doing some incredibly important work on healthy communities. Can you please introduce yourself and tell us a little bit more about that?
Yeah, thank you. And thank you for having me on this panel. So I'm with the Environmental Defense Fund. So we're a global environmental advocacy organization that's working to deliver transformative solutions to help stabilize the climate, but also really strengthen people and nature's ability to thrive. So the work that I oversee in what we call our Healthy Communities Initiative really has this vision that everyone has a right to a healthy environment and that we all thrive in a healthy environment. And that really looks like trying to drive down exposures to pollution, toxic chemicals, toxic air pollutants, as well as we begin to think about resilience and adaptation, how do we expand access to those things that we actually want, right? Cleaner air, clean water, safer products, safe homes. And we use a lot of different tools to do that. We're very grounded in science, economics, and partnerships. We do a lot of private public partnerships with community organizations, all the way up to Fortune 500s. And I think what I've seen shift in my time doing this work is just the reality that climate change now is the largest global threat to public health. And so if you just think of extreme weather events, wildfires, floods, extreme heat, those all have immediate acute effects on health, but also long-term chronic impacts, deteriorating air quality, water quality, rising infectious disease. And so when I hear about what the consumers are asking for, right, they are seeing and feeling these effects right now. And I think what's interesting in that space is that there's real opportunity for education. It's interesting you're doing the work with the pharmacists to really help people not only take the right steps to protect themselves, but to think about how is the environment actually impacting my health, and because there's lots of opportunity for intervention there.
Yes, lots of opportunity. We're seeing that ourselves. Okay, well, next question to Sally. You've been leading Forum for the Future's Climate Health Coalition for numerous years now. Can you please introduce yourself to the audience and share what you're seeing and learning from that work?
Great, thank you. Great to be here, everybody. I'm Sally, Executive Director of Forum for the Future, a sustainability non-profit. We're a 501c3 here in the US. We operate in Europe and India and Singapore. We're teeny tiny, but we have a big ambition, which is to accelerate transformation towards what we call a just and regenerative future. And one of the approaches we take towards that transformation is really focusing on unlocking the power of the private sector in particular to drive outside solutions. And about 5 or so years ago, it became really clear to me that everything a business does to decarbonize, everything a business does to build adaptation has got a health benefit. And so we established the Climate and Health Coalition to really enable private sector action at that intersection of climate and health. And what we're seeing is amongst private sector actors increasing understanding of those connections, and then really specifically in consumer health, a kind of outsized positive role to play. So Vinay talked about sun, but there are other impacts of our changing climate where consumer health brands have got a really important role to play, from heart health. So elevated temperatures put more pressure on our heart, increase the incidence of heart disease. We can take aspirins to alleviate that. We know that climate change is also causing rises of infectious diseases. Insect repellents can help keep us safe against that. Extreme weather events disrupt food supply, can interrupt access to nutrition. Vitamin supplements, again, can play a role there. And then we also know that extreme drought causes hydration issues, flooding causes pollution issues, and again, that access to hydration. And the last thing to say on that shift in the weather patterns and the role for consumer health brands is actually the allergy season is also shifting. So we know that that is the case, and asthma increases are really happening. And so again, another role for consumer health brands to help us breathe more easily.
Yes, thank you. And you hit on a really important point that is a question we're asking ourselves at Kenvue around how we can connect individual and collective action to really unlock brands being able to achieve a much larger positive health impact. We work with several healthcare organizations. Vinay mentioned training over 7,000 pharmacists on the importance of sun protection and the proper use and application of that. But can you help, Sally, share another successful example of something you've seen successfully drive change?
So the approach we take in the Climate and Health Coalition is twofold. We want to harness the collective voice of the private sector, and very specifically the healthcare sector. So not just consumer health brands, but pharma brands, health insurers. And one of the, I guess, early wins in the coalition was, along with other organizations, we collectively advocated for the first health day as part of the climate change negotiations in Dubai. And so that is a really great example of collective action, elevating all boats, creating an elevated understanding of the links between consumer health and climate in particular. And so collective action raises awareness, it shifts the sort of underlying system, and then that leaves individual brands free to kind of really move ahead and target specific interventions that drive positive impact. And so we often think that maybe collective action is sort of at odds with individual action, but actually the approach we take in the coalition is to lift our understanding of these issues, all boats rise, and then you can kind of go in different directions according to your unique contribution to the issue.
That makes perfect sense. Well, so then you mentioned those interventions that brands can use for individual or collective action. Sarah, can I invite you to, do you have anything you'd like to add on different levers from your perspective?
Yeah, I mean, the point Sally just raised about elevating health on the international stage has been really important, and we've seen that shift in terms of just more dialogue about the intersection of health and climate. So it's been transformative over the past several years. But I would say that, one of the things that we bring to these issues often, right, is a combination of what are all the different levers that you can pull to get at any one issue. So is there a policy lever to pull? Can you be working on the private sector to align incentives for change? How do we think about the role of data and access to data to better understand how we make these changes? So we've done work with a number of different private entities. Years ago, we started working with Walmart to develop a sustainable chemicals policy. This was like over 10 years ago, and at the time it was really the first evidence-based policy where we were actually looking at what's actually in the supply chain, where can there be improvements made, and not just bring down, again, what we don't want, but how do we accelerate the things that we do want. And I think that was a really powerful partnership because they had so much influence over the market at the time. And so, in other times we've really looked at where are the policy plays where we can make change on this issue. I think right now, when it comes to climate and health, one of the things that I'm most inspired about is the combination of strategic partners, data, and kind of the commitment to evidence base that's still there, that are coming together at the local level to build both resilience and mitigation opportunities that are actually improving health and are bringing more wealth and development into communities. So I feel like that's the part that health is bringing. It's making this climate about people. It's making about how do we invest in people and their communities. And so right now, as the world is changing and people are looking inwards, that's where I feel that there's a lot of opportunity, and pulling the levers of working on the ground with communities and with more, I think, private partners who are looking at where can my company make a difference in community. I think it's just an interesting piece to bring into the fold with community groups and municipal governments all trying to solve this same problem on the ground.
And I'm sorry, I love that because, as brands, right, and we've seen that, for example, at Kenvue, the more we bring everybody in the journey, then the easier for all of us it is. And the benefits, of course, is for the consumers and for the planet. For example, on Listerine, we moved all our bottles from plastic to 100% PCR. And when you look at the cost, actually, we have to absorb the cost at Kenvue because some of the markets around the world don't have, the infrastructure to bring actually the PCR at the right cost. And I think what you're saying is absolutely true. And the more we can democratize this, and the more we can work as one team around the world with the governments, with the suppliers, with the brands, with the consumers, then the better it is for everybody in the system. Yeah.
Yes, one of the ways we're really proud of at Kenvue to share, to build on your point about democratizing this information, is we have earlier this year launched something that we call a Sustainable Innovation Profiler, which is essentially a tool that we're embedding into the way that we design and develop our products that lets all of our 1,800 product developers understand the sustainability impacts of their development decisions. So it's not something that we're developing this product and then we do a life cycle analysis and measure what the result is. We're really, along the way, as we benchmark cost, stability, efficacy, performance, we're also benchmarking sustainability. And that does include climate, plastics, green chemistry scores. And so that's one of the ways that we're committed to really embedding sustainability in our practice. So I am conscious of time here, and I'm also conscious that we have an audience full of practitioners. They're strategists, they're advocates, they're doers. One of the things I'd like everyone to respond, but I'd like us to reflect on what is our ask of them, right? Let's end with a call to action, because there is a lot to do on this topic. So I'll start to give you guys a second to think about that, but I'm gonna go back to what I was just talking about with our Sustainable Innovation Profiler. And I would like to ask, where appropriate, that each of you are more intentional about integrating environmental sustainability considerations into your product development processes. A company like Kenvue, people trust us to bring them the solutions that help make their lives easier and their healthcare. They're not asking for some of the unfortunate consequences that come with the trade-off. So we really need to be addressing that. And climate change is no different when it comes to changing air quality, number of days in the sun, mosquitoes, allergies, as you mentioned, water stress. All of these things are changing our consumers' daily rituals, habits, and behaviors, and we need to be ready to respond to that. So please, Sarah, could we start with you, and just what is your ask of the audience here today?
Yeah, that's just a small thing. Well, I think that two things. One, obviously, the product itself that's coming into the home, in this case, I've been amazed at the journey that so many companies have been on in terms of thinking about what's inside the product, and increasingly then, of course, the whole life cycle of the product. And I think I've been involved with efforts to try to better understand not just the climate greenhouse gas footprint of, say, the life cycle of a product, but how is it contributing to things like air quality and water quality? So really taking an integrative look at that, because if we're actually thinking about how to improve the health of the consumer, right? They're a consumer and they're a citizen of the planet. And so the more that we can address their needs and be preventative, lower the incoming, whether it's pollution or pollen or heat, that's what's gonna make us all thrive. So thinking about the holistic impacts, and I think in particular, and Vinay, you mentioned this, the end of life cycle, right? The waste issue is such, if you go to the emerging markets, low-income countries, the waste infrastructure is so poor, and the impacts on human health are enormous. And so it's really just a plea for that. And I know that it's hard because everything comes with a price point, but that's really, to really embrace that full impact cycle at the design side. And that's really exciting that you guys are doing that initiative. It sounds great.
Yeah, thanks. Sally, do you want to go next?
Sure. Again, two things. My ask of all you beautiful people, and I can't quite see you all, is number one, see the connections. Because if you see the connections between climate and health, and nature and health, and communities and health. You can't unsee them. And what that then allows you to do is multi-solve, to make everything you do drive multiple benefits in multiple systems. If we think about adapting to a shifting climate, that has got obvious health benefits. If we adapt to a shifting climate by enriching nature, that's got obvious biodiversity benefits. So see the connections, multi-solve. And then the second thing is just to see potential, not risk. And what I mean by that is our operating context is quite challenging at the moment in different parts of the world. We're facing all sorts of headwinds. And it's sometimes easy to say, well, how do we manage this risk? I would say, what's the potential that we're not seeing? And for all of those of you in the audience that are part of a brand, understand that actually brands are so powerful advocates of change. They raise awareness. Brands can go further and faster than any public policy instrument. So that's the second ask. Shift from seeing risk to see potential. There's so much out there.
I love that. I can't agree more. And maybe my ask to you is, listen to the young generation. Like, listen to your kids. Listen to the young generation. They are looking for better products. They are looking for more sustainable solutions. They are looking to us to provide them with these solutions. And as the global brand lead on baby, of course, we don't only provide powerful solutions for babies, but also for kids and for tweens, right, which are the young generations. And when we listen to the young generation, the 9 to 12, the first thing they say is, I want a product that is clean, and I want a packaging that is sustainable, right? So this is what they are looking for. So we need to, and they will grow up and they will ask the same thing, right, when they will become adults. So we need to help them, and we need to provide that to them so that when they grow up, they become adults, they are ready to have the solutions in their hand. So let's listen to them, let's follow the journey with them and provide the solutions for them so that they are ready for the future, and we are ready for them for the future. So that's my ask.
Yes. Great. Well, some great asks coming from my fellow panelists here today. And hopefully you've taken some insights away so you can start to, maybe you're inspired about ways you can take action in your day-to-day job as you leave here and move forward. So thank you so much for spending the time with us here today. Thank you to my lovely panelists and to Nest. And I actually think we're ending a few minutes early. So maybe you guys could please check out our Kenvue lounge, which is just to the left as you're exiting the main stage here. So we'd love to see all of you out there and discuss our Healthy Lives mission further. Thanks.
Thank you.